Can you send that to me? And then why couldn't I play it for them?
You could.
I could, make it easier. Okay. What is, first of all, let's take a look at the medicines. Okay, so we need to take a look. I haven't gone over this yet, but I wanted to look at it real quick to make sure we're all on the same page. Okay. There are only 4 classes of medications that really are on there. So if I would ask you which one is used to promote urine output, what would you tell me?
Diuretics.
Diuretic. Yep, diuretic. And it's, what about if you had a bacterial infection and you need to be treated?
Antibiotics.
And antibiotics. Now let me ask you this question. I know when you get a urinary tract infection, you go to the doctor and you get a urinalysis. A UA just simply identifies if there is anything growing or how your protein levels are. But what's the CNS do? And that's one of your words right here. It's one of your abbreviations, culture and sensitivity. What does a culture and sensitivity do? Isn't that what tells you exactly what microbes are growing in there and how it should be treated? So what antibiotic would be effective against that microbe that's growing in your urine? Okay, so I need you to know that for me. I need you to know what a CNS is. All right, what about if you have a spasm of the bladder, right, that sometimes can cause our bladder not to empty completely? What kind of medication we give you?
Antispasmodic.
Antispasmodics, yes. And of course, then you know there's only one left, it's potassium, and that we're going to give you that if you need, if maybe you're on a diuretic that's depleting, like Lasix, just like it was on that movie we just watched with the other class. You get potassium as a supplement just to help you maintain your potassium levels. Okay. We also talked about pus in the urine. What is pus in the urine?
Can't remember, but it's so gross.
Yes, it is. Would you remember the medical term for that? Py, or on page 366, pyuria, right? Pyuria. Look right above that on page 366, and it's oliguria. What's oliguria?
Scanty.
Scant amount of urine output. So the person's not urinating a lot. It's just a very small amount. And we had mentioned that. What about if we do a urinalysis, a culture, or we do a UA, and then we end up doing a CNS, and we find that you have bacteria in your urine? What is the medical term for bacteria in the urine?
Bacteriuria.
Yep, bacteriuria, absolutely. So that is an important one to know. What about what if you have a nitrogenous compound in the blood? What is that known as? Nitrogenous compound in the blood. And I'd like for you to take a look at page 365 for that. Second one.
Oh.
Azotemia. Yep, azotemia. So make sure that you know that one. So what about if you have high levels of potassium? We had mentioned that. What's the medical word part for potassium? Sounds like a little girl's name, Callie, doesn't it? Callie, so kalemia. So if you have high levels, you have hyperkalemia. If you have low levels, you have hypokalemia. All right? We need to know what calcium is. Calcium is calcemia. If you have high levels of calcium, it's
Hypercalcemia.
hypercalcemia, and low levels would be
Hypocalcemia.
How would you spell hypokalemia?
hypokalemic.
Okay, so it's not an I there.
No, that I would drop and you
Gotcha.
EMIA. Okay, what about if you have a crushing of a stone? We learned about this in a couple chapters back. Crushing of a stone.
Lithotripsy.
Lithotripsy. Absolutely. So that would be stone crushing. The other day we talked about a tube that comes out of the kidney to the outside and it drains into a bag. Do you remember what that was called?
Trying.
It's on page 368. It's a nephrostomy tube. Nephrostomy tube, and it's where urine drains from the kidney. So there is a tube that is directly into the kidney, and that urine comes out. You bypass the ureters, bladder, and the urethra, meatus, and the urethra. Okay, what about if someone wanted to make an incision into the kidney to remove a stone? What would that be?
Nephrotomy?
Nephrolithotomy.
Nephrolithotomy.
Yeah, let's put the word stone in there. So nephro, Nephro, then lith, Lith, and then otomy, Otomy, right? Nephrolithotomy. Okay, go back to page 368 a minute. Make sure you know what colic is, what reflux is, and what that extracorporeal shock wave lithotripsy. I know we talked about lithotripsy, but I want you to know that whole word, ESWL, please. Please know that. Remember, that's where they're using just the vibration, the lithotripsy, but if you take a look at the next one, that percutaneous nephrolithotomy, right, they're actually making an incision into to remove a stone, correct? All right, what's a fistula? What is a fistula?
Oh.
Page 370.
An abnormal passage from one
Hollow organ
organ
to another.
to another.
Yes, yeah. A real common one, it talks about the bladder and the vagina, right? A vesico-vaginal fistula. Right? What is involuntary incontinence?
You can't control your bladder.
Cannot control. And sometimes, so if you're incontinent, you cannot control the discharge of your urine. So if you have incontinence, we also call it enuresis. ENURESIS. Make sure that you know that. Very important. Okay. We also looked at page 371. We talked about hydronephrosis, right? And I want you to also know interstitial cystitis. So chronic inflammation of the bladder wall that is not caused by a bacteria infection and is not responsive to conventional antibiotic therapy. It's also called painful bladder syndrome. Okay? Now, I need you to know that one as well. What is Wilms tumor?
It's
What age do we normally see that in?
in children.
Children, yeah. It's a rapidly developing tumor, and we do see it in children. What page is that on? 372. It's also called nephroblastoma. Okay, it's also called nephroblastoma, so make sure you know that. Let's look at this cystoscopy that is right on page 373.
Oh.
Yeah, that's a heck of a thing, isn't it? Examination of the urinary bladder, so they're taking a scope, right? And they are passing it up, in this case through a man, but you can also pass it through the meatus of a woman to obtain biopsies, to take a look to inspect the bladder wall, or you can even remove polyps. So it's a very handy thing to have, absolutely. All right, what would you tell me I had if I told you that I have to go to the bathroom, but I already had an accident? What is that called? Sensation of the need to void immediately that often results in enuresis. We commonly see it with a UTI.
Urgency?
Urgency, yes. Yep. Lots of times it is, once you say it, it's too late. Oftentimes you've already gone to the bathroom. Maybe not completely empty, but you've probably wet your pants some. Okay, what is a neurogenic bladder?
It's impairment of bladder control as due to brain, spinal cord, or nerve damage.
So we have somebody, because of loss of nervous system control, the bladder is not able to respond appropriately, right, like it usually does. So it doesn't have control of either storing or emptying. So a neurogenic bladder leads to incontinence, difficulty urinating. Sometimes they can't even empty their bladder, and so these people have to be catheterized. Maybe they do it themselves, or someone, their caretaker does, or they cannot urinate. So horrible thing. Okay, what is BUN? What does it stand for, and what does it help us evaluate? BUN.
Blood, urea, nitrogen.
Yep, blood, urea, nitrogen, and that's on page 374. And it helps us to determine kidney function. It is a blood test that helps us to determine kidney function. Okay, and there's that culture and sensitivity, and there's that urinalysis, and you need to know all three of those, right? Okay, what about, what is polycystic? What's poly mean?
Many.
Many, and then cystic.
Sites or cells.
Okay, so polycystic is going, it's actually a inherited kidney disease. Let's find it.
I just found it on 372.
It's sacs of
what
fluid
is it?
in the kidneys.
372.
372.
Okay. Yeah, polycystic disease. It's right above neurogenic bladder. Okay. It is a type of an inherited kidney disease in which the sacs of fluid develop in the kidney. Okay, sacs of fluid or cysts. Yep. If cysts increase in number or size, or if they become infected, kidney failure may result. So sometimes when we have kidney failure, we might have to get a kidney transplant, but oftentimes we might have to do dialysis. There are two types of dialysis that your book speaks of, and I'd like for you to take a look at that. And we're on page 378. There's dialysis can be defined as filtering procedure to remove fluid and waste products from the blood because your kidneys are no longer working. If you have hemodialysis, if you take a look on page 379, this is a gentleman that's getting hemodialysis, right? So blood is actually taken out, ran through a machine, and then put back in. His blood, his own blood, is filtered. Another type of dialysis is peritoneal dialysis. So peritoneal dialysis, this is where, again, the blood is filtered, but listen to this, dialysis in which the toxic substances are removed from the body by using the peritoneal membrane as a filter by perfusing or flushing the peritoneal cavity with warm, sterile chemical solution. People can do peritoneal dialysis in their home. All they have to do is just be able to do it by themselves or have a caretaker, and they would need to wear a mask when they do it, and they have dialysizing fluid that's put into their peritoneal cavity. They have a catheter in their stomach, and it's for their peritoneal cavity though, not into their stomach, not like a feeding tube. And they put fluid in, and then that fluid is drained out. That fluid is then discarded, and it does help to get rid of a lot of the waste products and poison that are in their peritoneal cavity. That doesn't work for everyone, and lots of times hemodialysis, which is much more restrictive, they usually have to go to a clinic. We have a dialysis center up here, or they have one at the hospital, and they go in either 1, 2, 3 times a week, or maybe every day to get hemodialysis. And that is a picture right here on page 379, the 2 different types. So please have a good working definition of both of those. Okay, what is renal failure?
Failure of the kidney.
Failure of the kidneys to work. Absolutely. Do you see that anywhere?
No.
I'm starting to think that's a dead mouse.
What?
I'm starting to think
The
that
smell?
is a dead mouse.
It smelled a lot like cabbage.
Well, I can guarantee you before, I did get rid of that over the weekend, but I think it smells like a dead mouse now.
Did the dead mouse eat cabbage?
Probably. Probably.
Renal failure. No.
I mean, it talks about end-stage kidney disease.
What page is that on?
370. So it says end-stage renal disease. So there's little to no remaining kidney function.
Okay, little to no, okay. So, I would look over that one as well and know the ESRD. What if I didn't have any urine output? What is that called? So polyuria means much. What if oliguria means scant? But what if I had no urine output?
Anuria.
Anuria, I know how to spell that.
Urinary.
Okay. What would be what's the medical term for surgical removal of the bladder? Surgical removal. So surgical removal is an ectomy, right? And if you're just gonna take out the bladder, it's a cystectomy.
Cystectomy.
Cystectomy. Okay? What if I had an obstruction, like you see on here, we talked about that hydronephrosis. You know, you see the stones, the calculi, right? Calculi that are stopping up the ureters. Of course, it can go in any place within the kidney. Lots of times they have to insert a thin, narrow tube to help the ureter to open up and allow urine to drain. What is that called?
Catheter.
No, we're putting in a thin tube within like the ureter. It's not going up through your meatus. This is just a very thin, narrow tube that is often inserted in the ureter to treat urine flow obstructions like that hydronephrosis. And it just keeps it keeps it open. That's called a ureteral stent, right? A stent placement. You know how you can get a stent in your heart? You can get a stent
There it is.
in any part of your urinary system, especially those ureters, right, that are coming directly off the kidney. What is that section of the kidney that those ureters come off of? We talked about that the very first day.
I bet we did.
We did. And it's the medial border. And also the renal artery and the renal vein exit the kidney in that area too. The hilum, right? The hilum or the hilus. That's kind of, the kidney bean, that's kind of like the little dip.
Can
right
you
there.
repeat all of those that you just said, like the last like 3?
The renal artery and the renal vein actually coming out of the kidney on that medial border known as the either hilium, H-L-I-U-M, or hilus, H-I-L-U-S.
Awesome.
Okay, what is the outside of the kidney called? And the inside of the kidney called on page 360?
The renal cortex is the
Outside, and the inside is the
renal medulla.
renal medulla, yes. And what are those microscopic individual little filtering units within the kidney?
Nephrons.
Nephrons, yep, you got it. Okay, what is the medical term for urination or voiding? So if you need to pee, right?
Micturition.
Micturition, absolutely. Absolutely. Okay. All right, what about, we talked about what a nephrostomy tube is, right? You know what that is. We know what a diuretic is. Let's look at some abbreviations. VP, IVP.
Intravenous. I think it's pile something.
Yep, pyelogram, an intravenous pyelogram. Or sometimes in your book, well, it says here in your book, you could even, it's even also called an intravenous pyelography. But same thing, one's a picture, one's the process of recording. But this is a radiographic imaging of the urinary tract after an intravenous injection of a contrast media is known as an IVP. So in order to visualize this, the kidney and it's working, we put contrast media in, or dye, so we can see it. We've already talked about ESRD. Do you remember what that was for? The chronic renal failure. And you said that was on page what?
I think it was
370.
yeah.
Yep, end-stage renal disease. Okay, so let me just ask you this one. This is a medication question. I'm having a leaky bladder in which I have an overactive bladder. What type of medication do you think they would give me?
Potassium supplement.
I have a leaky bladder. They're gonna give me an antispasmodic. Remember, we said that, you know, that can help it, decreases spasms in the urethra of the bladder by relaxing the smooth muscle lining in their walls, thus allowing normal emptying of the bladder. Bladder spasms can result from such conditions as a UTI and catheterization. So anytime you have a leaky bladder or anything with emptying the bladder, they're going to give you an antispasmodic drug. Okay, what is an incision that enlarges the urethral opening to relieve urethral stenosis? Well, first of all, what's the opening called? Urinary.
Meatus.
Right? So a mediotomy, otomy, right, cut into, would be the incision that enlarges the urethral opening or the urinary meatus. Spelled M-E-A-T-O-T-O-M-Y, right? All right, we talked about a mediotomy, we've talked about a lithotripsy. What about, how would you, give me a word that would mean the formation of a stone?
Lithogenesis.
Lithogenesis. I said that you need to know what pexy meant. Very first thing we talked about, Pexy, P-E-X-Y. Surgical what? Fixation, surgical fixation. Okay, so tell me what would be the medical term for surgical fixation of the kidney?
Is it gonna be the renal or the
Nope.
It's
nephro?
It's gonna be the
Nephropexy.
Nephropexy. Yes. Okay. What word means dilation or expansion?
Ectasis?
Ectasis. Yep. Now, okay, what if we wanted to dilate or expand your ureters, which are coming directly off the kidneys, emptying into the bladder?
Urinary
Would be a ureterectasis, spelled U-R-E-T-E-R, ureter, and then ectasis, E-C-T-A-S-I-S. I should redo this test. There's a lot of words in here you can actually get from looking back through your test.
I think that means you should leave it.
Yeah, I'm not retired.
I mean, with that many matching.
What if I wanted to give you a delivery of medicine directly into the bladder? What is that? What if I wanted to give you medication directly into the bladder? Talking about the urinary bladder. I haven't found this yet, but I'm sure it's in here. Intravesical, I-N-T-R-A-V-E-S-I-C-A-L. Has anybody ran onto that? It's intravesical.
Is there anything else to that one, or is it just that?
Nope, it's just that. That's all it is.
And that's going directly into the bladder?
That is putting medicine directly into the bladder. Intra, I-N-T-R-A, vesicle, V-E-S-I-C-A-L.
I do not see that one.
Yeah, I haven't.
I'm just seeing if they might have stuck it back here in your review. I don't really have time to look, but you get it. Okay, so we talked about knowing what reflux is, right? Knowing what dialysis is. We talked about polycystic. We talked about urgency, renal failure. What is pyelonephritis? P-Y-E-L-O.
Infection of the kidney.
So it'd be an inflammation of the kidney. Let's find that in your book.
Inflammation?
It's 372.
372?
So, yeah. It's infection of the kidney that usually begins in the urethra or bladder.
Okay, yes, right here. Yes. So that is an infection of the kidney, usually a result of infection that begins in the urethra or the bladder and ascends the ureters to the kidney. It requires prompt attention to avoid permanent damage to the kidneys or from spreading into the bloodstream. Okay. I think that's probably gonna get you. It's only, what's renal calculi? What's renal calculi?
Calculi are also stones, right?
Yep, they sure are.
So
renal
kidney
calculi would be
stones.
Kidney stones, yep, that's all it is. Absolutely. Okay, one more thing. Can you tell me the test that uses electrical probes to measure the contraction of muscles that control urination?
Electromyography.
Yep, what page is that on?
373. It's the first
373.
one.
Okay. some true and false. Okey-doke, that's it.